Hey everyone, my name is Liz Rektoriak, and this is my MBC 494 Baccalaureate RN Leadership Synthesis Project. This leadership synthesis project is about increasing patient satisfaction through the elimination of strict visiting hours, promoting patient and family-centered care within this initiative, and creating family information sheets to keep family members informed of typical unit practices. The specific aim is to increase patient satisfaction by eliminating visiting hour restrictions in the open heart unit at Mercy Hospital of Buffalo. This project promotes nurse leadership as it involves removing a policy which was restrictive to a loved one's access to the patient and allowing family to be present in patient care at all times and a part of the care team. Collaborators for this project were a hand-picked team of fellow nurses, a charge nurse, a nurse practitioner, the nurse manager of the open heart unit, and the unit clerk. All team members worked closely together when formulating the family information sheets and the questions on the patient surveys. The unit clerk mailed out the surveys. The nurse manager was there as a support system as visiting hours became unrestricted and kept the team informed of hospital picker scores related to patient satisfaction throughout the project. All collaborators for this project were heavily involved in each PDSA cycle and planned out each one accordingly. The change concept came first from seeing how unpopular the strict visiting hours were with patients and their families. We had very strict and short visiting hour windows prior to implementation of this project. These were from 10 to 11 a.m., 2 to 3 p.m., and 8 to 9 p.m. only. Also, from reading the literature and learning how open visitation in the critical care setting improved patient and family satisfaction. Shulkin et al. 2013 stated eliminating visiting hour restrictions in intensive care units has been shown to decrease anxiety for the patient, promote family and patient advocates to exhibit engagement, and realize they are imperative to a patient's recovery. In that study, it was concluded that the implementation of open visitation can be accomplished with little disruption and improve the patient and family experience. With our desired outcome measures being an increase in patient satisfaction while focusing on patient and family-centered care, implementation of open visiting hours started. Some studies even demonstrated that open family visitation can lead to improved cardiovascular outcomes for patients. Being that our unit's focus is cardiovascular surgery, that evidence was of particular interest to team members. The quality improvement cycle began with PDSA Cycle 1. The planning and doing aspects involved officially removing the strict visiting hour policy in the open heart unit, removing the visiting hour sign outside the unit, and all nurses began informing each of their patients and patient families of this change. During this first PDSA cycle, I received assistance from team members in forming a family information sheet. This was created and given to families to inform them of our open visiting hours and contained language that stated hours of report and physician rounds so family knew what to expect. We encourage family to be present at all times. We just ask them to please refrain from calling from certain hours in the unit, which are from 6 a.m. to 8 a.m. and then 6 p.m. to 8 p.m., as these times we are handing off care of their loved one to the oncoming nurse and rounding with surgeons. To study these changes, patient surveys were sent out and asked whether they liked or disliked the unrestricted visiting hours, whether it aided or infringed on their recovery, and the level of comfort they felt by having their family there as needed. On week 5, 12 surveys were sent out, and by week 7, we had a 75% return rate. On each of the 9 returned surveys, patients scored our questions with either a 9 or a 10, which stated they were extremely satisfied with the new unit practices and felt having their family present aided in their recovery immensely. With this PDA cycle being a success, we acted by keeping visiting hours unrestricted in the open heart unit. The second PDSA cycle, was geared towards comprising a family information sheet for patients' family members, the goal being to provide patient and family-centered care, include the family as much as possible, and provide important information to the family. With our big change already enacted, which was the permanent unrestricting of visiting hours, the plan for the second PDSA cycle was to focus on patient satisfaction through family integration. Team members all had input on what to include on the family information sheet. We quickly realized this sheet would increase nurse satisfaction as nurses would not have to frequently answer the questions the information sheet provided answers to. This sheet began being handed out stapled to the sheet from the first PDSA cycle. After 1 week, nurse satisfaction of the integration of the family information sheet was studied by a verbal survey given by one of the team members. All nurses on both day and night shift gave unanimous 10s, indicating they were extremely satisfied. Nurses saw the value of providing pertinent information right off the bat, as this decreases anxiety. The plan was to increase information to the families. We did that through the development and integration of the family information sheet. We studied how effective the sheet was through nurse satisfaction and acted by making this sheet a standard of care in our unit. After the successful implementation of unrestricting visiting hours and dispersing the family information sheets, their enhancement to patient satisfaction was realized by assessing hospital picker survey scores, and patient satisfaction rose from 63% in January to 85% in April. With the success we see in this hospital data, we have decided to spread this project to other intensive care units in Mercy Hospital. The Open Heart Unit clinical educator has agreed to be the facilitator for spread and believes it will be received well as the project has had a positive impact on both patient and nurse satisfaction. Similar to the study done by Shulkin et al. In 2013, we found the process of unrestricting visiting hours in the Open Heart Unit was done with little disruption and improved the patient and family experience, as well as enhanced nursing satisfaction. As the American Association of Critical Care Nurses stated in 2012, unrestricted presence of a support person can improve communication, facilitate a better understanding of the patient, advance patient and family-centered care, and enhance nurse satisfaction. And I believe this project validated all aspects of that statement.